Hi guys, welcome back to my channel. If this is the first time I'm coming across my channel here on YouTube, you're welcome. I'm Kemzi and I am a final year nursing student, and in this video I'm going to be sharing with you guys tips on how to pass your nursing exam, especially your P.T.S exam. Now I'm making this video because when I was starting nursing and when I was in P.T.S class, I actually checked everywhere on YouTube to see if I could see videos that would help me know what to expect in my P.T.S exam. But I saw some, but I felt like they were not really relatable, and because I have passed that stage and I have seen what I have seen with my eyes, I feel like this video is going to make sense to people who are inspiring and coming into nursing and who are wanting to get insight on what they would do to help them pass their P.T.S exam. Just for clarity, P.T.S exam, P.T.S means preliminary training school, and the P.T.S exam is an exam that is held only by nursing students going to School of Nursing. So in case you don't know already, there are many routes that you can study nursing in Nigeria here, and School of Nursing is one of the easiest routes to study nursing in Nigeria. And in the School of Nursing, they do like a P.T.S. They have a P.T.S class. So they have a class where they call P.T.S class, and this P.T.S class is the first 6 months of you getting admission into the School of Nursing. So universities don't actually offer P.T.S class. Other schools that offer nursing do not offer P.T.S class. P.T.S class only applies to School of Nursing. Before we even start all these things, it's very important for you to know that nursing is changing. I mean, the Nursing and Midwifery Council recently changed her policy. Last year, they brought a new policy that eliminated the previous method of writing our exams. So for every promotional or professional exam we are writing now as nurses or as a midwife, you're not like writing it on a pen and paper anymore. They've eliminated that method. That one is obsolete now. We are now doing CBT, computer-based test. So in my school too, because they want us to be familiar with computer, that's for people that are not computer literate, they actually incorporated that in all our promotional exams. So in my school here, for you to pass your P.T.S test, you need to write your exam. The exam is now computerized. For a promotional exam to year 2, it is computer based. For a promotional exam to year 3, it is computer based. So you know that you have to prepare very hard. And the computer exam is not like the normal manual exam. The manual exam is way more easier than the computer exam. The reason is because the manual exam, it is set by the school. It is set by the teacher that is handling the course, and the teacher that is handling that course knows what he or she has taught you. So she knows that she has taught you cardiovascular system and musculoskeletal system, so she's supposed to set her questions based on these two topics. But if it is computer based, it is going to be set by an external who think that you should have learned cardiovascular system and musculoskeletal system. So if you only learned cardiovascular system and you did not learn musculoskeletal system, it is not her business. She's actually going to set the question based on these two things you are supposed to learn, and she's going to be picking them in between lines. So it is very important for you to know that now. If you're thinking of coming to any nursing school, I don't know about all nursing school, but I know that in my own school we have started it already. So the test now is online. Another funny thing about it is that the OBJ questions carries more mark than the theory questions. The OBJ is 350. No, the OBJ is 150 questions for 40 minutes. That was the last one I wrote. I wrote 150 questions for 40 minutes, and then the theory questions were just 2. So if it were before, we are just going to have like, is it 50 questions, and then the theory question is just going to be plenty, and then you have like 60 marks for the theory and then 40 marks for the objective. Now objective carries more mark, and objective, they are setting in between lines, so you have to read every nook and cranny of your book. You're not even reading your notebook, the one your lecturer gave you. You're reading your textbook, because that is where informations are going to be carried out to. So that being said, let's move over. Talking from my own experience, because I think experience is the best teacher. So when I came into this school, when I came into School of Nursing and I started the P.T.S class, the first thing I did was to know the courses I was offering, and then I looked for a senior colleague that I actually liked and find her friendly and comfortable. So when I found her, I actually made her my friend, and anytime I am done for a day, like I am done for my class in a day, I would go to her, and anything I don't understand or I didn't understand during my class section, I'm going to let her explain it to me. If you find that you can find someone like that that you can trust and that you are comfortable with, it's going to be fine. But if you feel you can do it on your own, then it's also going to be fine. But that is what I did. I would go to her sometimes, and then she would actually explain it to me, or I would meet a colleague, a classmate of mine that actually understood what that lecturer said, and then I'm going to understand it better. So you actually know yourself, and then you know which one is going to work for you. When a teacher is in class teaching, you might really not understand what the person is saying, but if your classmate actually explains it to you, you might understand it better than the way the teacher explains. You know, classmates or senior colleagues, they have a way of passing information to you that doesn't make it seem as bulky or as stressful as the one the lecturer actually prepared. So that is one trick I did, and I feel like it worked for me. So I know, so it might also work for you if you try. Another thing I really did was visual learning. Now, whenever they learn something in class, there are two things that are always going to be involved. It is either along the line I lose interest, or along the line everything starts merging up. All the things, like everything just becomes too much, and then my brain automatically stops working. So after that class, I usually do a visual learning. This one actually works in OSCE, like procedures. If they are doing a procedure, I observe it. If I see that this thing is not going well, or it is very difficult for me to understand, I actually go back on YouTube here. I type in the procedure, for example, passing of NG2. I type it on YouTube, and I see the various methods that they can use to pass this NG2. But if you're learning online, especially procedures, you should bear in mind that if the people that are performing these procedures are in US, their own method is quite different from our own method. So you should know that if you're thinking of using US method of passing or of doing a procedure in your OSCE, you might fail it because your examiner might not want the US method while here in Nigeria. So if you're here in Nigeria, you want to make sure that any procedures you're learning online, it has to be Nigerian, so that you would not fail your OSCE. But then for topics like maybe blood circulation of the heart, muscles of the face, cranial nerves, any topic at all that I find very stressful or difficult, I go back to YouTube, I type in that topic, and I will see lectures that some people have done. Now when I listen to that lecture or when I watch that lecture, trust me, it makes it very easy for me to actually assimilate. And then after watching those videos, I go back to my textbook and I read them, and it just sticks. It just sticks. So if you're finding it difficult to actually study, maybe because your brain is already full just like we normally think as students, or maybe because the lecture was actually very bulky, or maybe because the lecturer didn't pass the information as adequate as you think he would have done it, just go back to YouTube, type in the subject or the course you want to do, type in the topic, and then you see list of those topics that are going to come out, like videos of those topics that are going to come out, and then you look for the one that is suitable, because most of those videos come with animations. And you know what happens in animations? For example, if you're reading circulation of blood in your textbook, or if someone is explaining it to you, you might not really understand it. But when you go online and watch a video where you actually see how the blood is flowing in the heart, you would get to understand it. Even the description of how the blood is flowing, like the picture or the video of how the blood is flowing, will actually make you remember the whole narration and the whole explanation. So visual learning for me is a thing that I do often that works for me. Till now, I still do it. Another thing you should know that is going to lead you astray is cramming. Now, you should know that cramming is not bad, but it becomes bad when you are doing it intensively. It becomes bad when you are doing it in all the courses. There are courses you can cram, or there are things you can cram, and there are things you should understand. For example, if you're talking about your chemistry and your physics, all those formulas there, you should not understand them, you should just cram them. I mean, how to calculate velocity, how to calculate light, how to calculate thunder, how to calculate all those things, how to calculate meters and all those things. You just need to cram the formula. But how does fetal blood circulate? You need to understand it. Because if you want to start cramming how there are two arteries and one artery is vein and one is oxygen and one is, you actually forget it. You might actually cram it very well and you say it perfectly, but when it comes to when you are supposed to deliver what you cram, that is when you understand that you did not do anything. You should learn to know when you should cram and when you should understand. I should also understand that what you should cram should only be numeric factors that can't be changed, like the ones that are stagnant and constant. But when it comes to physiology, when it comes to something you need to know, you don't need to cram it. Another thing for you to do to pass your P.T.S exam, which I actually started doing, but then I started doing it lately, was I started teaching more than reading. I would understand, I would explain, I said I would understand. So everybody read, even the people that fail exam, they actually read. Now the problem is not that they did not read, the problem is just that they read but they forgot, like they forgot what they read. So one thing I did that actually made me not always, because I still forget some things, but at least I remember like 80% of what I read, is the fact that I teach what I read. Now I have a friend that if we pick a topic, for example we pick the nervous system and we read it together. Now when we finish reading it together, we have a particular time when we come together. When we come together, she is going to teach me what she has read. After teaching me, I'm going to ask her questions, and if she has the answer, or if she can get the answer, fine. If she doesn't know the answer, I'll tell her the answers. Now in return, I am going to teach her what I read. After teaching her, she's also going to ask me her questions. If I have the answer, fine. If I don't have, she's going to tell me the answer. So I came to realize that teaching her actually made it easier for me to retain what I have learned. So teaching is actually a great method of retaining what you've learned. It's also going to make you fluent. You're not trying to cram, you're trying to give out your input, you're trying to output what you've already put inside your body. So if you're only reading and reading, you'll keep on assuming that, oh, I know it, if I see it in the exam, or I know how to tackle this question. But when you're thrown a question, you realize that you don't actually know it. But then when you try to teach people, when you try to ask people questions, when you try to engage yourself in question and answer, it's actually going to make you understand it more, and then you become very familiar with it. Another thing I like to do is make flashcards. When I'm reading, I always like to write out what I have read. For example, I might finish reading maybe a topic or a textbook or a page. When I finish reading, I'll try to write out what I've read again. So it's just like garbage in, garbage out. I'm trying to test myself to see if I can remember all that I have read. So if I can remember all I've read, if I can write out all I've read, I'll give myself a bravo. But if I can't remember or write out all I have read, I have to go back and read it again. Trust me, it's frustrating, but then there's no other way out. I have to read it and read it and read it till I am fine, that I know that I can actually do this. Another thing I do that is very good, when I am reading, I map out questions. I write out likely questions that might come out from this particular topic. So as I am reading, I'm asking myself, what question can come out from this particular line I'm reading? So as you're reading in between lines, and you're trying to ask yourself, how many questions can come out from this line? And as I'm asking myself how many questions can come out of this line, I'm also recording those questions. I'm also writing out the questions. So by the time I'm done with this particular textbook, I have like 20 questions. And when I'm done with this page of this textbook, and I start asking myself those questions to evaluate myself and to see if I can answer those questions I wrote out while studying it. So that is one thing I do that I actually like. So please, if you're reading, You may want to think of writing out questions that you feel might come out from that particular page you're reading, because it's also going to enhance your own ability to answer those questions. If you can answer your own questions, then you know that there is nothing that they are going to set from this book that I don't know. You understand how it is? So guys, I hope that this information was useful to you. If you have any questions, if you have any suggestion, if you have any addition as to what you should, like if you surpassed P.T.S class and you feel you have anything you did that made you stand out, please drop them down in the comment section. And thanks for watching. Bye.